Hi, my name's Dr. Kat Zucker, and I was asked by some of my dental colleagues to help explain and help alleviate some of the frustration that folks may be having about why, since other places are open during this COVID pandemic, why can't my dentist get me in for some dental work, be it repairs, cleanings, other procedures that I feel are necessary and urgent. And I agree, it's incredibly frustrating. I want to be back with my own primary care patients and seeing them in the clinic, but unfortunately that's not where we're at right now. So I just wanted to run through very briefly why dental procedures are especially dangerous for patients as well as the practitioners, and then talking through some of the protective equipment. So the issue with the COVID-19 virus, coronavirus, is that it primarily is spread either through droplet or airborne contact, and I'll break down what both of those mean. The virus itself tends to live in the upper respiratory system, so that means the oral or nasopharynx, which is the all the way back of your throat and all the way back of your nose. And the nature of a dental procedure where the patient is breathing directly in and out during the procedure very close to the practitioner's face, and that many of the procedures take tiny droplets of that potentially infected saliva, because remember, folks can shed coronavirus and be infective from a COVID-19 standpoint long before symptoms occur. And so whenever a practitioner is in somebody's mouth working with that saliva or those mucus secretions in a way that causes them to turn from droplet into airborne, that's what becomes more difficult. So if you're talking about a scenario in which you may be encountering somebody who is shedding coronavirus, the wide recommendation right now is a surgical mask. So these are the ones that have the ear loops. These can also be made from cloth, and these do help cut down on the number of particles that are shed from an asymptomatic carrier, or that somebody who is exposed to an asymptomatic carrier may be exposed to. And again, this is only at a droplet level. So if somebody were to cough or sneeze, they would generate droplets that would come out into the air. However, for many of the dental procedures, anytime that there's suctioning, rinsing, any grinding especially of the mucosa, you turn that droplet into a very fine airborne mist. And for that you need a higher level of protection. So that is, for example, one of these N95s here that you've talked about. These need to be fit tested. These need to have a very tight seal. These cannot be homemade with the materials that anybody usually has at hand. And then when I go see a COVID-19 patient who has any risk of aerosolization, what I wear is a P100, which is a very tight seal to the face. This is what other first responders, ICU folks are wearing. Obviously, these are in incredibly short supply right now. The ability to get them appropriately fit tested is very, very short supply. So when your dental provider, even though it seems like a relatively minor procedure, they are being exposed at the same level of risk of somebody who is being intubated, which is to have a tube put down their throat to go on the breathing machine, on mechanical ventilation and life support. We as physicians, we do that because we have the equipment and there really is no other option. If this person doesn't go on life support, they will die in the next minutes, hours, or days. So if these dental procedures are not causing active threat to life or quality of life, it is frankly irresponsible for any dentist to expose themselves or their staff to such an extraordinarily high risk, knowing that the proper protective equipment just is not available at this time. These are all being diverted to, as I said, intensive care unit nurses, doctors, respiratory therapists, because the folks in those intensive care units, in those emergency rooms, have no choice but to get life-saving treatment. So if we can allocate those resources to only life-saving treatment, and as frustrating as it may be to have non-life-saving treatment delayed, it's important that we do this as a group.